My name is Alfaro. I'm a general physician with training in skin care, and I own Med Spa Delicate. It's a medical spa, recently opened 6 months ago, and we specialize in receiving post-operative patients, especially from my father's practice, but we do from others also. We offer lymphatic drainage, especially for post-operative treatments. This kind of massage, manual massage, is an excellent option for patients after surgery, 2-3 days, sometimes 5 days after surgery, to help with swelling and inflammation. The less swelling there is, the less pain and discomfort for the patient. So we usually recommend up to 10 treatments, either every other day or every day, depending on what the patient wants. But of course we evaluate the outcomes day to day. So some people have 1 or 2 treatments, others have 5, depending on the procedure, of course. A tummy tuck, for example, it's one of the largest, longest procedures, has more swelling. We've had people have about 5 treatments after the tummy tuck, and they are doing really good. They have less liquids trapped in them, so they have less swelling, so they have less pain. It's easier for them to move around, for example. After having the treatments, they don't feel as stiff or even as frightened to sit up straight or to walk straight. That is what usually happens with them. We also, for example, have treatments to complement liposuction. People have the surgical version of the liposuction, that of course is the best kind. And then a few days after lymphatic drainage again, they can have a I think it's called cavitation in English. It's a kind of ultrasound that helps melt fat away. We have the ultrasound produces a vibration of the fat cells, and it breaks the pore, so then the fat starts, just like coming out of the cell, and after that we use again lymphatic drainage to take it out of the body through physiological processes that are normal. Usually we recommend patients to stay in Costa Rica for 10 to 12 days, up to 2 weeks after a tummy tuck. What we can do with this is help them feel better sooner. So then at 10 days, they're doing wonderfully. Okay. Of course, they still have to be careful and not exert themselves. They can't pick up heavy objects or do a lot of strenuous activity, but they will be able to tend to their needs by themselves without any difficulties a lot earlier. I'm the only MD. Then I have a girl that's a physical therapist and an esthetician also. She's had experience in 5-star hotels here around Costa Rica for a while. And then another girl who's an esthetician, and then the other one is actually an administrative, basically. We also have my father that comes in once in a while to help us out with certain procedures that are more surgical. We need a specialist. I don't like to do things that I'm not trained to do, which happens a lot. And you really have to be very careful where you go to do or to have done what kind of procedure. So we have here, for example, a variety of fillers, dermal fillers for nasolabial folds, peri-oral or peri-ocular orbital wrinkles, smoker's lips. We have fillers for volume for the lips also, or the cheekbones, the nose, a lot of different options. We're promoting this vampire lift. Vampire lift is a filling of the face, of different aspects of the face, with a platelet-rich plasma. So it's a product from your own blood that's processed in the lab downstairs, and we inject it in different areas to help rejuvenate the face. We also do Botox, of course, and all the other fillers hyaluronic acid and
do you do varicose vein treatments?
we have a laser and IPL platform from Palomar. It's a Starlux 300. It does sunspots or liver spots, I think they call them, and vascular lesions, especially small lesions on the face, some small on the legs, not the big ones, not varicose veins, the ones that are large. Those need to be treated by a specialist. And we also do the photofacials, microderms, chemical peels with pure acids. I got my training in the States, in Dallas actually. Those are great chemical peels. There's no redness, there's no flaking, there's no downtime. It's like what you could do during lunch break. You come, you have your chemical peel, and you go to work. The only thing you can't use is makeup for the rest of the day. But next day is fine.
Talk about your education. You mentioned you studied in Texas?
Well, I studied here in Costa Rica. In my medical degree is from Costa Rica, from Huaca. And then I went to Dallas actually for it's a pretty quick course in medical aesthetics. So I have a degree, and I could work in Dallas actually with that degree in medical aesthetics, and everything that's, lasers, microdermabrasion, dermaplaning. That's even a little, it's an exfoliation similar to microderm, but with a scalpel to the face. The chemical peels,